Welcome to the Hot Pot. I'm Lenaya.
I'm Nhien.
And I'm Casey.
We are excited to bring back the Hot Pot podcast. This show is a space to have important conversations, share knowledge, experiences, and insights, while honoring the unique identities that make up Asian American, Native Hawaiian, and Pacific Islander communities.
In our previous episodes, hosted by Princess May and Tracy, aka the Princess and the DJ, covered topics like health equity, vaccine awareness, and culture and identity.
We're each part of the community engagement team at the Asian and Pacific Islander American Health Forum, the oldest health advocacy organization serving Asian Americans, Native Hawaiians, and Pacific Islanders in the U.S. and U.S.-affiliated Pacific Islands. In firing up the hot pot once again, we'll be sharing information on critical health issues affecting AANHPIs, interviewing guest speakers to provide expert insights, and of course, finding levity and community through sharing stories and experiences.
And as new hosts for the Hot Pot, we'd love to introduce ourselves and share a little bit about our own stories. I'll start. I'm shaped by two coasts, two cultures, and a whole lot of unique to me experiences. I'm the daughter of a white mother and a Filipino father, but raised with my Filipino family. I was born in New Hampshire, spent my childhood in Southern California, and my adolescence in the suburbs outside of Philadelphia. I used to feel like the world didn't reflect me in it. I was somehow always standing on the outside. But as I've grown, I now see myself reflected in the world in more ways than I could have imagined. Nhien, what's your story?
Yeah, thanks for sharing that, Linnea. That was very lovely. So for me, I'm a second generation Vietnamese American. My parents came to the US in the 1980s as refugees from post-war Vietnam. I was born in Texas and grew up in the Midwest, but I currently live in Oakland, California, which I'm happy to call home these days. For me, growing up meant coming to understand that the intersectionality of who I was and came to be was heavily influenced by my experiences living in different parts of the country as a member of an immigrant Vietnamese household, which I explored a little bit in a Health Forum produced docuseries that I hosted called Our Diaspora. Check that out on our YouTube channel. And outside of my work at the Health Forum, I'm also a photographer and I make short films. And my other hobbies include cycling and being a bedroom DJ, which is not too uncommon these days. What about you, Casey?
So I grew up in the San Francisco Bay Area to immigrant parents from Taiwan and Singapore. For me, language barriers were a huge part of navigating my Asian American identity. On one hand, I could talk with my parents, sisters, and classmates just fine in English, but then communicating with my elders was a very different story. So my paternal grandmother or ama spoke Mandarin, Taiwanese Hokkien, and Japanese, and my maternal grandmother or popo predominantly understood Cantonese. So, growing up in a family with different language barriers taught me that mutual understanding can go beyond having technical words, but I know that is certainly not the case when it comes to navigating different parts of systems and institutions, especially for healthcare. And that is what brought me to the Health Forum and why advocating for language access, that is, ensuring limited English proficient people have equal access to services and programs, is such a huge passion of mine, both professionally and personally.
Thanks for sharing those stories. So to wrap up our introductions, why don't we do a lightning round of questions? What are you all most looking forward to about the relaunch of the Hot Pot? I'll start. I'm really excited just to meet our community partners in this very unique space where we can explore who they are and where they come from and why they're doing the important work that they're doing. What about you, Nhien?
Yeah, so for me, I'm really interested in continuing to explore themes of AA and HPI identity and culture. And I also really enjoy all of the behind the scenes work in producing and the audio and visual aspects of making a podcast. Casey, what are you looking forward to?
I'm really excited to learn more about different health topics that affect AA and HPI communities, especially on subjects that I personally don't know very much about, and then to help spread awareness as well to a broader audience, because I just know there's so much that falls into the umbrella of health topics. So diving deep into specific ones is just something I'm personally looking forward to.
What about you, Nhien? Do you have a final lightning round question for us?
I do. So I want to hear what's everyone's favorite thing to order or eat at a hot pot restaurant? Linnea, you go first.
As long as it starts with a pork bone broth, then I'm pretty happy. You can mix it up from there. What about you, Casey?
First off, I agree with the pork bone broth answer. I recently had like the numbing spice, like mala broth, and I just couldn't handle it. I feel like starting with a good foundation is really the best way to approach hot pot. But shout out to anyone who can stomach the spiciness. I just personally couldn't. As far as toppings go, I really love taro. I think it just adds like a nice nuttiness to a flavor of the other flavors going on, and just yeah, new dimension to the hot pot. And then Nhien, you got to bring us home. What is your favorite thing to have at a hot pot restaurant?
Yes, so mine is 4 letters, AYCE, all you can eat with unlimited meats. And that is it for our introductions as the news host of the Hot Pot. That was fun, y'all. So I know I'm excited to be relaunching the Hot Pot podcast, and it's going to be fun working with you, Casey and Linnea. And Linnea, do you want to talk about our newest episode?
We are so excited to share the first interview of our relaunch. For this episode, we're going to dive into a topic that's near and dear to my heart. It's a topic that's foundational to health and yet often missing from our conversations. Overcoming perinatal health barriers for the AANHPI community. When we talk about health advocacy, we're often focusing on chronic diseases, mental health, or health access. But what about the health of our moms and babies? What about that critical period from pregnancy through the first year of life that sets the stage for lifelong wellness? I spoke with two incredible advocates, Tonya Lang and Grace Yee, from the AANHPI Lactation Collaborative, to learn more about their work in expanding the conversation of essential health and filling those crucial gaps in support of AANHPI families. Enjoy the episode. Why don't we start with your origin story? Tell us about the collaborative and how you came to be.
Sure. The AANHPI Lactation Collaborative came together in 2021, and we were all working kind of separately in the lactation reproductive health world. But what brought us all together was just our joint desire to fill in gaps in knowledge about chest and breastfeeding in our communities, and the resources available and the lack thereof to support our communities. So the collaborative fosters connections between AANHPI individuals, groups, organizations who provide lactation education and support, and work on reproductive health justice. So we are mostly California-based. We're a north-south statewide partnership that also conducts outreach and partners with other AANHPI groups throughout the nation, and also mainstream state and national organizations.
Thanks for sharing about the collaborative. And then what about independently? What is it that your work looks like? I'll start with you, Grace.
Thank you. For over 39 years, I have worked with the community and public health agencies. And through all those years, I actually fell in love supporting mom and baby to breastfeed. And thank goodness, after I retired, I got approached by Tonya and Cindy, and I am so thankful that I have the opportunity to continue investing my passion and my long-term heartbreak to do something that I can improve.
Yeah. Well, I'm sure they're happy to have your 39 years of experience and
Yeah,
wealth
I
of
was
knowledge.
going to say, Auntie Grace talks a lot about how she was so fortunate to find us, and it's really the opposite. Let's be clear. We are very grateful for Grace's involvement in the collaborative and just the opportunity to learn from all of her experience. The way I came to lactation was, through the birth of my first child, right? I think that's how a lot of folks end up there or in the birthing world. My background's in public health. So I worked on health promotion, mostly around chronic disease prevention. And then I had my first baby and realized how little support pregnant and postpartum parents have, whether it's education during pregnancy, lactation support afterwards, and support in, when you need to go back to work, right? As many of us need to do. So that's kind of how I came into lactation work. I'm an international board certified lactation consultant. I've also been a La Leche League leader, so I do volunteer lactation support, and I've done so for about 20 years. And now a lot of my time is spent with the collaborative.
Thank you. I can relate to that piece around being inspired to come into this work after having children. I did a short time practice as both a birth and postpartum doula, and just largely motivated because of the experiences of going through birth and then those early years. And I will say, I was surprised prior to having a child of my own. I just never really thought about lactation.
Right.
And it's not as straightforward as I would have thought. And the need for support is actually quite significant.
Absolutely.
So tell me a little more about the collaborative. Like, who do you serve, and what does that work look like?
Yeah, sure. So the AANHPI Lactation Collaborative mobilizes communities to advance lactation and reproductive health justice for AANHPI families and protect our right to thrive. It's really our focus. How can we set up our families to thrive? So we work through justice through advocacy, data equity, capacity building, education, and policy to drive systemic change. So we don't offer direct services per se. Many of us in the collaborative offer direct services, like I'm a lactation consultant. We have a couple other IBCLCs involved too. So we might individually offer lactation support and services, but our collaborative is really focused on systemic change. So we're coming from a strengths-based perspective where, language and culture are not barriers. Mm-hmm. These are things that should be viewed as assets and supports, because there are a lot of things in our culture that are very supportive of pregnancy and lactation, mm-hmm. Healing for new moms, and how we take care of our babies, right? So that's another thing that's very unique about us. We also put high priority on mentoring young professionals and students, including those who want to become IBCLCs. So we are, I think I'd mentioned we are focused on capacity building. This is one way that we're really working on capacity building. So bringing up and training and supporting and mentoring kind of the next generation of leaders. That's really important to us. So, uplifting our emerging leaders in lactation and the public health spaces, while also incorporating the wisdom of our elders.
Thank you so much. The collaborative really has a much larger reach than simply a direct service or lactation services. It's really about building a whole culture of support for AANHPI throughout that
Absolutely.
Perinatal, which is amazing. So thank you for that work. How should we consider perinatal and infant health when we think about children's health in general?
I think human milk provides immediate nutrition and food security immediately. And also it's custom made for the newborn. And then it has the capacity to change in their quality and their quantity in order to fit the baby's growing needs. Formula cannot do that.
Yes.
Okay.
So the milk, the nutrition in the milk and the actual makeup of the milk changes.
Right. And also, it also provides immediate immunity, because the baby come from natural birth. The baby receive a lot of immunity through the birth canal. And then afterwards, if the baby has skin to skin, he receive more immunity from the mother's skin. And through breastfeeding, he receives the last drops of antibodies.
I love that. I always think how beautiful our bodies were designed to go through this process.
Right.
And provide what we need.
Yeah, also it is tailor-made for each baby. Each mom's milk fits her own baby. So yeah, why not provide, why not focus on lactation? And then the amazing immediate effects is that it also provides psychological benefits. Oxytocin, when the mom holds the baby to herself, immediately she feels relaxed, her mood is changed, and her emotion is regulated, and she's able to love her baby, and the baby feel the mom, and the baby feels security. So all these are good for the brain development. And also, I'm sure you have heard about DHA and ARA, all those omega-3 and omega-6 fatty acids. Breast milk has both for the brain development. So all these are immediate benefits.
So there's so many details of that process of breastfeeding that I think is really never explained, and it's not common information. So I think that kind of, I think whether people realize that they might benefit from a lactation consultant or any kind, you don't know what you don't know.
Yep.
And
Absolutely.
then, look how much there is to know.
Absolutely, there is, and it's really amazing, right? Because when we talk about the immunological benefits, we know that breastfed babies don't get sick as often, right? Part of that is that whatever mom and baby are exposed to in the environment, if mom produces antibodies to those, to whatever it is, bacterial, viral infections, those antibodies can be transmitted through the milk. So what might happen is maybe mom gets sick, everybody in the family gets sick, but if mom is nursing, then baby might not get sick because baby is able to get those antibodies through the milk. So it's really amazing.
Hey, Casey here with the Inside Scoop. Did you know that getting vaccinated while pregnant can also protect your baby from viruses after birth? As Tonya and Grace were mentioning, studies show that by breastfeeding, you can pass antibodies to your child that can help protect them from disease. And key to that is making sure you are vaccinated beforehand. And for folks with children already, make sure to look into the Vaccines for Children program, which provides no-cost vaccines to children whose parents or guardians may not be able to afford them. Visit our resources page at APIAHF.org to learn more about tips on immunizations during pregnancy and the what, why, and when of vaccinating your child. We have fact sheets and infographics translated into multiple Asian and Pacific Islander languages so you can keep your families and your communities healthy and informed. Now back to the interview.
What are the main issues and challenges that people might face when they're either breastfeeding or chest feeding?
I think one of the biggest issues that people face when they're trying to breastfeed or chest feed is that lack of support. So not having the education and support. Honestly, I think that's what it comes down to.
And also, I think that even as an educator, I think we should involve the family.
Yes.
Including the elderly
Yes.
family, because I'm sure that they'll be more than happy to support, except they don't know how to support in the best way.
Absolutely. And I think when we're looking at AANHPI families, the role of extended family is huge. If grandma is not on board, then maybe breastfeeding won't happen, even if mom wants it to, right? Right. So really education has to involve, not just the birthing parent, any partners, but the whole family, anybody who is going to be taking care of baby.
That makes a lot of sense. Grandma's very influential.
Yes. Oh, absolutely.
So why don't we talk about what makes finding and receiving lactation support particularly challenging within the AANHPI communities?
Well, so I think we've been talking a lot about general barriers, right? Everyone faces these barriers. It's kind of universal that birthing parents will feel undermined, will not necessarily get all the information and support they need. When you're talking specifically about AANHPI families, we also have to add on the fact that it's very challenging to find culturally humble and language appropriate lactation support because there aren't very many folks who look like us in the lactation and birthing world, right? And so it's very challenging for parents to find somebody who speaks their language and understands their culture and understands how to involve the entire family and integrating culture into any care plans, right? Any cultural practices or what might be important to that family right in front of them. into any care plans, as opposed to, oh, okay, I know these people, these people do these things. All right, so we need to just kind of work around that. And I say these, it sounds like a joke, but it's not, because I've heard providers say these things to me, right? And so we really encourage, again, just kind of flipping this, changing this attitude, right? There are a lot of cultural practices that are supportive of breastfeeding and postpartum healing, like specific foods or keeping the mom warm or all these things,
Going back to that strength-based.
Yes,
Yes,
It's like, how do we
exactly.
celebrate the cultural knowledge that families
Exactly.
already have?
Right.
Exactly. Because those traditions didn't come out of nowhere, right? They didn't come out of nowhere. These are things that have been important to families for generations. And there's a reason, right? There's a reason. It's because they're actually health promoting, but maybe the rest of the world hasn't caught up with that yet.
Right.
Right?
Yes.
So it's, there's lack of culturally humble, language appropriate lactation support. There's a lot of systemic racism in healthcare, and that's probably a whole other podcast episode, right?
Yes.
Yeah.
Yes.
And implicit bias amongst healthcare staff who continue to perpetuate myths about our families. So again, it's the lack of providers that look like us and also have very negative views about us and may not be able to or even want to offer the appropriate lactation support to our birthing families.
Yes. So and I'm curious about what data challenges you face, what that looks like in the lactation and perinatal practices.
Yeah, there's very limited breast and chest feeding data for AANHPIs due to our general invisibility. And I would argue it's not just limited to perinatal data, right?
Yes.
It's, I don't have to explain to you what are the data challenges for our communities. So, very briefly, despite the diversity of our communities, that's not necessarily how we're perceived because of the model minority myth, right? So, people view us as all a monolith. We all are the same, have the same needs, seem to be doing well in general, right? But that's not necessarily the case. Our communities are very diverse. So maybe we have some subgroups that are thriving, and then we have many others that are not. But because we're all lumped together into one big umbrella group, we don't know, right? So it's basically a case of, well, we make assumptions about our communities. And so, but we don't really know. And because we make those positive assumptions, then, our communities are ignored when it comes time to divvy out resources, right? So then that adds to that, extra layer of invisibility. So, data equity is incredibly important to the collab because we cannot achieve true equity without data equity. Right. Yes. And I'm sure for the health forum,
like you said, that is true across
across all races.
Healthcare.
Right. For all of health.
If you lump
data in general.
Yes.
Right.
Yes.
Data in general.
Oh, yes.
Yeah.
And the other thing too is a lot of the surveys are only done in English and Spanish.
Well, that was the next thing I was going to segue into. We have language access, and then also when we're talking about populations who English is not their first language, these are serious considerations in terms of like a barrier to getting your proper care.
And then interpreter. Their services are so overly demanded. Their supply is short, is not enough. And then when the interpreter is available, there may be some reservation on the moms because it's talking about her body.
Right.
And the interpreter is a male.
Right.
So all these are barriers.
Yes.
And then the other thing too is non-English speaking mom, they are seldom offered the service of an IBCLC.
There is
because the IBCLC don't speak
systemic racism,
right.
built into.
That's why it's so important that Tonya pointed out, we need to really grow our own IBCLC.
What would be your top priorities moving forward as a collaboration? If there were things you wanted to focus on, what would be your top priorities?
As a collaborative, we would love to connect with any organization, all organizations who serve families, right? So we can just talk about the needs of our pregnant and postpartum families, and also kind of learn, about how, what care needs these families have in, like, in all these other topics. I'm not sure if I'm being articulate right now, but you know what I mean?
Yes.
And then, it's like making that connection, right? Like, how can we make sure that our families' needs are integrated into whatever is being done to improve the health of our communities in general?
Train responders, train families about breastfeeding.
I think a lot of times people, when there's an emergency, their first instinct is to donate formula, right? And that may not be the best option, because a lot of times in those emergencies, you don't have access to clean water, ways to wash feeding implements, that kind of thing. So I feel like that's probably a whole other conversation.
Yes.
So
I wish we had more time, because that was actually in our previous conversations. That was something that I had never considered, and I'm sure that's true of many. Well, unfortunately, we don't have more time, because I could go and talk about this for much longer. But how can people connect with the AANHPI Lactation Collaborative?
They can reach out to us by email, our website. We would love to have conversations about how we can work more closely with other organizations. A lot of the things that we talked about, barriers to care and language access and everything, that applies to all different health topics, right? So we would just love to connect with others.
Thank you both so much.
Thank you for your patience.
Thank you for your time.
We love
thank
to
you
talk.
for all of your amazing information and your willingness to just show up and share and spend time with us. And that's a wrap on this episode of The Hot Pot. The foundation we're missing is more than just about lactation support. It's really about the support of our moms and our babies, our whole health, and the health of our families. Make sure to follow the Health Forum on social media at APIAHF.org, and you'll see it in our information. And subscribe to our YouTube, and also sign up for our newsletter, and stay updated for future episodes. Thank you. Bye.
Bye.